Hello, my name is Luis Ange, and today we are going to talk about the Flowable Composite Injection Technique. Indirect ceramics are the material of choice when it comes to oral rehabilitation, but not all the patients can afford them. The Flowable Composite Injection Technique emerges as an alternative to the indirect ceramic restoration. This technique consists of copying the wax up into the patient's mouth using a transparent silicone index that allows for light curing of the composite through it. This is a technique that is accessible for everyone, does not require excellent skills, and allows for a quick, predictable, and a good aesthetic result. The big disadvantage is the removal of excesses and the aging of composite over time. For this technique, the flowable composite must have good mechanical and aesthetic properties to ensure the durability of our restoration as well as the patient satisfaction, good polishing properties, and a high percentage of inorganic filler. Good examples are the Voco Heavy Flow and the GC Universal Injector. With floatable composites, this technique is easier, more predictable, and the removal of excesses is easier. On the other hand, to obtain a higher and longer lasting degree of polishing, we can use heated compactable composite. Place the composite directly into the silicone index, heat the composite with a dryer, and place the index in the mouth. The holes, in this case, serve as an exit for excesses of composite. Good examples of packable composites for heated are the Gradia Direct and the enamel function. The answer depends from case to case. If you ask me if you can skip this step, of course you can, because it is resin composite and whenever you want you can add material or remove material. But in order to not have surprises at the end of the treatment, you should at least ask for the technician for the wax up project and to evaluate the thickness and aesthetics of it. This is especially important in cases where we want to change the color of the teeth, because a good thickness of composite is needed to hide the original color. We should do mock-ups to see if the wax up meets our expectations, to obtain the approval from the patients whenever we don't trust the work of the prosthetic technician, in cases of color change, to assess the thickness of the wax up, in cases of full arches with increases in occlusal vertical dimension. When we still don't have much experience, we can skip the mock-up when we already have a lot of experience and can correct the flaws on spot freehand. In cases where there are no color changes, and when we already know and trust the work of our prosthetic technician. In the clinical case that I'm going to show you at the end of this presentation, I only realize the lack of volume of the wax up when I put it in the patient's mouth and realize that one of the laterals needed a little bit more volume. In that case, it allows me to anticipate the problem and correct the wax up before going for this technique. One of the most important steps in this technique is the design of the transparent silicone index. There are a lot of silicones available, but the most important thing is to know how the materials behave so that we can choose the best manufacturing method. The chosen silicone must be as transparent as possible, that allows us to see what we are doing. The problem with these very transparent silicones is that they are very expensive and also very flexible, like GC Exactly. That is, the silicone index is easily distorted and can result in asymmetrical and deformed restorations. In these cases, to prevent the index from being distorted during treatment, it must be surrounded by a 1 mm thickness thermoform plate. There are silicones with a lower transparency but a higher rigidity, which reduces the degree of distortion when placed in the mouth. In these cases, we can use a metal tray, fill it with the silicone, and bury the wax-up model there. There are silicones with less transparency but higher rigidity, and that reduces the risk of distortion of the restorations when placing the index in the mouth. As transparent silicones are more expensive than molding silicones, we can use both materials. First, we make an index with molding silicone as if it were a mock-up index. Then We cut out the silicone of the area that corresponds to the teeth that we are going to restore, and in that area we fill it with transparent silicone. This method has two major advantages. It is cheaper because we use less transparent silicone, and on the other hand, the molding silicone, which is much harder, will give more stability, thus reducing the distortion. An interesting tip is to order two models of wax up, one with all the teeth waxed up and another one with tooth yes, tooth no waxed up. This makes it easy to prevent the excesses from running over the adjacent teeth. How do you use it? So, first, you use the silicone index with half the teeth waxed up, and only the second time you use the index silicone with all the teeth waxed up. Once we have the silicone index made, now it's time to do the holes that allows us to inject the flowable composite. These holes can be drilled with a turbine or a handpiece using very fine burr. The diameter of the holes should be equal to the diameter of the composite tip. The location of the holes depend from the extension of the wax up. If the wax up is exclusively vestibular, the hole should be made in the incisal edge slightly vestibularly. If the wax up is 360 degrees, holes must be made on the buccal and the lingual side in addition to the incisal occlusal area. Removing excesses is the most complicated part of this technique. To be able to remove excesses, we must have scalpel blade, fine burrs, dental floss, interproximal polishing strips with different thickness, and a wooden adage. In this chapter, there are no rules. The goal is to obtain very polished surfaces that allows for a good hygiene from the patient. Polishing is a very important step to ensure a good final aesthetic result. For that, we must use polishing discs, for example 3M Soflex discs, polishers, for example Eve Diamond Plus. They are two rotating polishing instruments, a pink one for pre-polishing and a gray one for the final eye shine polishing. Goat hair brush and shoot brush that can be used with polishing pastes. This sequence must be respected to ensure the best aesthetic final result. Now let's see a clinical case step by step from the beginning to the end. The first steps are common to any oral rehabilitation treatment: initial photos at the rest position and maximum smile position, intraoral scan or impression, lab communication with digital smile design, wax up and mock up. In this last step, it is important to obtain the approval of the patient before proceeding. Then we need to make the silicone index. In this case, I use the molding silicone plus transparent silicone technique for a better stability. We place the obturate in, isolate the teeth with Teflon and proceed with adhesion. The protocol that I use is this one. With this step concluded, it is time to place the index in the mouth, check the correct setting and inject the resin through the holes. We can light cure every time we inject the resin into a tooth or everything at the end. After light curing, remove the silicone index, remove the excesses, finish and polish until the end, and only then move on to the other teeth. Why is that? To prevent that the composite that will eventually overlap the teeth already restored does not remain adhered, and thus the removal of excesses is much easier. Now just repeat it with the other silicone index for the remaining teeth, and here is the final result. I would like to finish this video with some final thoughts. This technique is only indicated for patients with a very good oral hygiene. Maintenance appointments for polishing must be done every 6 months. Alert your patients to the risk of fracture and the aging of composites. Alert your patient to the importance of the oral hygiene in the longevity of the treatment. 1 week before the treatment, the patients must rinse the mouth with a 0.12 chlorhexidine to ensure a healthy and not bleeding gingiva. I hope you liked this video. If you have any suggestion for future videos, leave in the comment below. Bye bye.